joining us to talk about senior issues and senior care issues now is a certified senior advisor from Care Patrol of Oakland County. Kari West is with us on the Oakland County MegaCast. Kari, thank you for being with us today.
Thank you, Tyler. Thanks for having me.
We appreciate it. How are you? How's your team been at Care Patrol of Oakland County?
Doing good, actually. Pretty slow for the first 3 months of the shutdown, but in the last 2 months, it's absolutely gone crazy again. Getting really, really busy again.
For those who are unfamiliar, could you just give us a little overview about what Care Patrol does?
Yes. Care Patrol is a free community service. We offer placement services for families, their loved ones, seniors themselves. We help place people that can no longer live at home, or they're just downsizing from a larger home and they no longer want to care for it or can't care for it. So they want to move into a community of seniors that are like them. So anyone 55 and older, we help to find placement, and we really tailor it to their personal needs. So financial, location, whatever their individual care needs are. So it could be an independent living community, assisted living, memory care, or even the smaller adult foster care homes, which are really, really great for people with memory care or Alzheimer's needs. So depending on the level of care really dictates, what we recommend to our clients.
Our senior care facilities have had a really rough time during the pandemic, particularly in the state of Michigan, where there's, of course, been issues with putting COVID-19 patients after they leave the hospital in nursing home facilities, of course, where they are not necessarily in close proximity, but in the same building as nursing home patients, and that may lead to a further spread of COVID-19. It's been a little bit of, at first necessarily it was maybe an impossible scenario, so to speak, where there's nowhere else for these patients to go, so they send them to nursing homes, and that creates other issues. In terms of how the pandemic has progressed over time, were these senior living facilities and these nursing homes put in an impossible scenario, or was there something more that could have been done to help prevent some of these issues?
Yes, I'm pretty passionate about this issue, actually. I really do believe that, when the governor had the 2 off-site hospitals built, one in suburban collection over Novi and the other one was downtown, they should have utilized those rather than forcing the nursing homes and rehabs to take these COVID positive patients. Because in the very beginning of the pandemic, in early March, even prior to the statewide shutdown, nursing homes and all of the assisted living facilities, rehabs, they had already shut their doors. So the last week in February, once this pandemic was kind of a global situation, and as Italy was evolving, all of our local Oakland County skilled nursing facilities and rehabs, they shut their doors to vendors like myself, outside visitors, family members. They really had it locked down well. So I have to give them a huge shout out and kudos to the owners, the managers of all of these different companies that decided that they were going to keep their current residents and patients safe. That's what they did. Unfortunately, rather than sending to these field hospitals, which we spent millions building, the governor decided to force the issue of having discharges directly into any skilled nursing or rehab that had less than an 80% total population at the time. Now, the reason they had low populations is because they were discharging patients and not accepting new ones because they wanted to protect their current population that was living in these or being treated in these skilled nursing rehabs, assisted livings, memory cares, and they were doing a fabulous job. So, I guess it's everybody's opinion, but in my opinion, had we not forced that issue, we would have a lot more seniors that didn't succumb to this horrible virus, honestly.
Can I get your opinion on what are your thoughts about having or allowing family members to put cameras or some type of device to be able to check in with their loved ones, especially during the pandemic when they've been able to not have that one-on-one contact?
I think it's a great idea. I really do. I think it's okay to have families have access to their loved ones at any time. I think that the new legislation that Jim Runstead has introduced is great legislation. I've worked inside assisted living, memory care, skilled nursing facilities. Sadly, have seen some situations that were less than, I guess, admirable from, different people. So I think that, if it were my mother and she was currently in a facility, I would want to have access to her. And I think it would be great to have those cameras in there because the seniors really don't understand technology. And so even though you have a memory care person and you're putting a tablet in front of them to say, here, let's visit with your loved one, or look at them, wheel them up to the window and see them in between, it's not the same. And I think as, a child of a senior, I'm going to be 60, so if my parents were still alive, they would certainly be at that age where our average age is between 80 and 85 that we place, then I would want to have access and be able to see them, and what's going on with them, for sure.
Kari West with us. She's a certified senior advisor at the Care Patrol of Oakland County with us on the Oakland County Megacast. And Kari, what advice do you have for families right now who are in a situation where one of their loved ones is at the age where they need to be maybe considering moving into a long-term care facility or into a senior living facility to uncomplicate the daily rigors of life for that particular family member? What should they be considering right now as they're looking for a facility to put their loved one in, as they're considering the ongoing pandemic? What should be going through their mind? What should be the first few things that they are thinking about before they take any action?
Well, first of all, I would get someone like myself or, Michael, my partner, to give you what's available out there, because we know 24/7 the communities, what their occupancy is. We also look at their state licensing. We do not partner with any providers that are not licensed by the state of Michigan, which is hugely important because our state happens to be one that does not require all adult foster care communities to be licensed. That is number one in our mind, because you need that state oversight to make sure that they're having those drop-in anytime visits by the state to go in and make sure that the care and the licensing is all in order at all times. And we do that. We've got our clients and our providers to make sure that they're doing exactly what they're supposed to be doing by the guidelines and the rules, governed by the state. So that's number one. Number two, make sure that there's a good ratio of caregivers to patients. Sadly, the entire healthcare industry right now is dying for healthcare workers. We are very low, and so you want to make sure that if you're considering a community, to find out if in fact they do have a full staff, because staffing problems are rampant right now in healthcare, whether it's the hospital, the rehab, the skilled nursing, assisted living, memory care, all of it. And then thirdly, does it fit into your price range? No assisted living or memory care in Michigan is covered by insurance or Medicare. It is all private pay. The only thing that's covered is skilled nursing after a hospitalization or rehabilitation after a hospitalization or a surgical procedure. Everything else is going to be private pay, and that can run anywhere from $3,500 a month to $14,000 a month, depending on what type of facility and the level of care that your loved one might need. So that's where it really comes into play, the importance of working with somebody like Care Patrol so that we can really guide you and help navigate that world for you.
And Kari, what advice do you have for these senior living facilities and these nursing homes going forward as they're continuing to battle through this COVID-19 pandemic, continue to provide the care that they need to be providing safely to their customers, and as they're maybe bringing more people, new people, into their facilities going forward?
It's really a matter of safety and security, in my opinion. I really believe that, they're doing a great job now. PPE is readily available again. Thankfully, we don't have the shortages we had in the beginning of the pandemic. And so they're really focusing more on infection control, infection prevention, really, by requiring family members, even vendors like myself, anyone entering and exiting the building to wear PPE or protective equipment, masks, gloves in some instances, and even to wear the full
Gowns.
Okay, gowns, yeah, gowns, and even face shields. Face shields are great for seniors, especially with memory care needs, because they don't understand why they have to wear a mask. And the face shield is like a visor that runs around your head, and then you have a complete plastic, shield in front that comes all the way down to your chest. So even people with glasses or people with breathing issues, which a lot of seniors that might have had COPD or congestive heart failure, they really can't breathe with a mask. So those are great options for people, and the communities are now making those available to their residents, which I think is a really good thing to do, because everyone has to be protected. Seniors are the most vulnerable. They have many comorbidities, which means they have underlying disease. Even before they get the flu or COVID, it makes them much more vulnerable to this type of thing. So safety and security is number one, always.
Kari, anything else for us before we let you go today?
No, just, I would say it's a fearful time for everybody, but we can do this safely. And if you're working with someone like Care Patrol and you're trusting someone like us to treat your loved one like they're our own and place them in a community we would place our own moms and dads and aunts and uncles, I think you're okay. You should be fine to place your loved ones. Isolation's a big issue. We don't want to leave these seniors alone, and living in a community to get that socialization with their own peers in a care setting where they can thrive. So really, it's always a positive. And people mostly say to us, I wish I would have done this sooner. So that would be my advice.
Well, Kari, thank you very much for being with us.
Thank you so much for having me.
We appreciate it. Kari West with us. She's a certified senior advisor at Care Patrol of Oakland County.